All right, you're watching our Monday special town hall coming to you live from the county of Mombasa, County 001. And the subject of our conversation tonight is universal health coverage. And I will just start with the two gentlemen on the other side. You have been watching things from a distance for a while. And Alfred, I'll start with you. How ready would you say this county is for the rollout of universal health coverage? As someone who talks to young people, who is pushing for the rights of young people to access health care.
Thank you very much, Joe. I think as a county, there are some progress. But when we talk about UHC, we talk about primary healthcare. And primary healthcare goes down to the basic, to the dispenser, to the community level, to the community strategy level. And my big question would be, how many community strategies do we have within the county? And community strategy means the community units at the community levels. Because we are saying that for us to achieve UHC, then it means we must offer primary health care at the grassroots level. Just from the video that we've seen, we are seeing that very many people are still getting referred to Coast General Hospital. But we are saying that for us to achieve this, then we must go to the basics. Under the UHC, we also know that there is the story of the NHIF. How many people are actually part of the NHIF? And looking at the issue of unemployment, most of us are young people in this county. More than half of this population are young people. If somebody is unemployed, can they actually be able to access NHIF services? That we still think that they are still very, very high for even that young person who is already employed. So for me, I say that there are some progress, but we still have a long way to go.
All right, and the governor will respond to that in a short while. Let's come to you, Bwana Wali.
Yeah, I think the county has made good progress. I was at Coast General Hospital myself, and I found that there is really a lot that has been done in that facility. But again, if you look at, we should not just not focus on the supply side. There's the demand side from the community, creating that appetite for the community to actually access or demand these services. So I think there's a lot
what does that mean?
There's a lot that needs to be done in sensitizing the communities to ensure that they are aware, first of all, that services, they really don't have to come all the way to Coast General Hospital. There are facilities at their doorstep that can actually offer services, and they really need to ensure that, first of all, before coming to Coast General Hospital to get maybe treatment on headache and all that, what services are available right at their doorsteps. But again, we still have challenges, like what my brother said about NHIF. We talk about the premiums, for instance. Are the premiums affordable to these communities? So is it then possible for us to come up with a formula to ensure that at least when you talk about NHIF, then even the premiums are not punitive to even that person who is not employed? Because NHIF is mandatory to people who are employed. But we have a very huge percentage of people in the county who are not employed.
And so what is your recommendation exactly?
My recommendation then is that we really need to come up with ways of ensuring that at least we don't rely on maybe one method of insurance like NHIF. Come up with what you can say hybrid methods, because there are countries like Singapore that have done that, where you find that instead of just relying on one method, they have actually come up with hybrids. So if NHIF is not going to be able to serve all the purpose to our communities, then what other options can we have to ensure that even the people who are not employed are able to get cover and access these services?
Okay, Dr. Manjari, what does a county like this need to have in place for you to sit somewhere as someone who understands universal health coverage to say Mombasa is ready for this rollout? What needs to be in place?
Yeah, thank you, Joe. I believe we need to focus on the health pillars. We look at the health infrastructure, we look at human resource, we look at health products and technologies, and we have talked about, because we all have that in KEMSA, that is the health products and technologies. we also focus on healthcare financing so that we don't impoverish mwananchi as they seek for healthcare. We protect them in terms of having a health cover, and we also look at what Mombasa is doing, private partnerships. Without that, we will not be able to talk about the numbers he's talking about, engaging private practitioners that he's engaging. And we also look at the health information for data and also for planning. And finally, we look at the issues of research, because we have to look at healthcare in what we call evidence-based medicine. As we look for this, then we can now discuss on the issues of affordability, issues of quality, and issues of access. And I want to commend Mombasa County, and they seem to be on the right track. And as we roll out, after the pilot study in the 4 counties, we believe the lessons that will be learned during the pilot will be taken by Mombasa for them to implement the healthcare coverage in a universal manner. So I believe they are on the right track, and we are here to partner, and we offer health products and technologies. I also want to commend my team that is working in Mombasa, the coast region, headed by Rukia. She's here, and they are doing a fantastic job engaging Mombasa governor on daily basis through his staff. And we are very glad that that's the reason that we even see that they are able to quantify, they are able to do forecasting of the commodities they want in this county. And by doing that, they know when to buy and what is in store and when we went to pay KEMSA.
So Governor Joho, where in that scale would you say Mombasa County is? Because by 2019, from all the projections I have seen, we should be having universal health coverage in some form rolling out, being realized in all the counties in this country.
Well, first of all, I want to say every speaker, hawa wote hawa ni kama walikuwa wameingia akilini kwangu. Really, wanasema yale ambaye mimi nataka kusema tu. Even in terms of preparedness, you know, obviously we've made progress, but can I tell you something? The point is to ensure that ordinary mwananchi, whether they have money or not, are able to get access to medical care or health care. And for me, that is where the country is headed. So we need to prepare ourselves. Yes, we want to be like Singapore, but it's going to take a bit of work, commitment, dedication, mipango, tujipange, sidio? So that tukifika 2019 and beyond, we must look at at beyond 2019. So as a county, to scale myself, really, let me use them, because for me, but
at least you can say we're doing 1, 2, 3 to be ready for that.
We're doing everything. You see the pillars that very well stipulated by Dr. here. It is exactly what we are doing as a county. We have dealt with the issues of infrastructure. We looked at the financing, and we realized we have huge deficit. Remember, Mombasa is a county that receives roughly, this year I think it was when we were moving to 8 billion a year, over which 3+ billion of our budget goes to healthcare. You know, out of the 8 billion, 3+ goes to matibabu. So we have to be innovative. That's why the engagement in the private sector, if it was not for the participation of private sector and donor community and ourselves, we will not be able to transform Coast General to the level that it is today. Hawa watu hawa wanasema sijui anakimbia hizo dispensary to go to Coast General. Li hawa zamani walikuwa wataki kwenda Coast General. Hawa. But they call me nowadays, they call me, really. I get calls, random calls. Kama unadanganya semeni mimi. I get random calls. Governor, nisaidie nipate kitanda niko na mgonjwa. I get calls, people moving from Pandya hospitals to Coast General. So ni hawa watu. But sisi, we are on the right track. We have modeled our financing. We have engaged the private sector. Sisi wenyewe tunaangalia what we can do. We're partnering with NHIF for that matter. We're working very closely.
Let's talk a little bit about NHIF in terms of registration, because
Mombasa has an uptake of 36% now, which is doing very well. But we are running programs. And I want to agree with my young brother here. it's still expensive for people who don't. 40% of our young people are unemployed, highest in the country. They are here. Wanataka kupata matibabu, wako hapa. So what do? We need to make it affordable. But this is a conversation that we will continue to have with our partners in national government, our donor community, the private sector, and ourselves. Kila siku we must evaluate how are we going to make it accessible, affordable, easily kwa mwananchi and an ordinary mwananchi. So we are on the right track. I think we have a plan. Mombasa has a strategic plan up to the year 2035.
Okay.
So we know what we want to do. We just have to we model it. Even the capital investment. We have looked at our resources. Tuko na nini, hatuna nini, and that so we had wanted maybe 2025, 2026, but we pushed it to 2035 because we needed to look at a clear capital investment plan that is workable with under the current circumstances. So
okay.
tuna nini? Tunasonga mdogo mdogo. Sasa nasema mdogo mdogo.
You need to you probably will need to talk very, very nicely to the people who come after you now that you're finishing your term in the next few years. But wacha tupate maswali mengine kutoka kwa wananchi hapa. Mwenzangu Mashirima Kapombe.
Kuna swali moja zile zilizoulizwa awali. I think it is only fair we answer them.
Ngoja tutauliza gavana. Tulia kidogo, umesema wewe mwenyewe kuwa mambo mdogo mdogo. Kwa hivyo wacha tuanze na kuna mmoja hapa ambaye anauliza swali kuhusiana na NHIF, lakini sasa kwa wale watu ambao wanaishi na ulemavu.
Amjambo.
Hatujambo.
Kwa majina naitwa Husna. Mimi swali langu kwanza nalisukuma kwa mheshimiwa wangu governor kuhusu mambo ya NHIF ambaye tulisikia kuna dona ambaye ameingia kuja kuandikisha mambo ya NHIF upande wa walemavu. But I'm asking nijue kimefikia wapi?
It is true. Kuna donors, and in fact we are reaching out to other donors kusema kwamba just like the same way we have done our volunteers, CHWs. We thought because of the kind of ile kazi wanaofanya we must provide coverage kwao so that wakipata nini is the same way we are looking at PWDs. And by the way, kama ungechukua muda, if you looked at the policy ambayo tuna develop kutoka kwa Department Youth and Gender, you will realize we want to do it in a way in that it is embedded in our legislation hapa. So sio ati kesho mimi nimetoka kuwa governor aje mtu mwingine anze kuja na idea zake mpya. We possibly even us as a county we want to find a way to immediately to do what to continue. But the donor is there, we're negotiating, we're finalizing, and hopefully very soon.
Huyu donor atakuja kufanya nini hasa?
Anaweza kulipa tu, kusaidia na kulipa tu. Donor anajua tunampatia program, we do a plan, we cost it na quantify ile nini, we present, we do a nice presentation. Siku ile suit umevaa ndio nitavaa mimi. So that's, and they do a presentation so that they can give us a bit of resources to saidia hao ndugu zetu. And that is where we're negotiating.
Maswali yafuatayo jo yanafanana kidogo kwa sababu bado yako kutoka kwa watu wanaoishi na ulemavu. Kwa hivyo nitachukua yote mawili ili yaweze kujibiwa wakati mmoja. Faith, kuna swali la kwanza, kuna mwenzake hapa atatoa sauti kwa niaba yake.
Yeah, Ruth. Thank you. My name is Ruth. And I'm from Chuda sub-county. And my question is to our Honorable Governor. My concern is about the assessment in different hospitals, the major ones and the smaller ones. For instance, when a mother has given birth to a child, then there's always a worry. Sometimes there are those who are born to be deaf, but we don't have early assessment facilities for the same. So many times they get referred to different hospitals. For instance, maybe EAC for the assessment. Then they are told wait. They'd be referred to other places. So the parent gets to be moved around and around and around. From there to different areas. They go to Kwale, go to Ziwani. So they get so confused. So most of the time, the parents, it becomes expensive for them and costly. They give up on the same. So what can we do to make sure that we have early assessment so that we can have early placement for the student, for the deaf in schools, and so that they cannot get late to be admitted? Thank you.
Swali lingine ni la Owino, labda naweza kuliuliza pia.
Okay, hello. My name is Jones Owino. And my question is about also, it's on health, about access for the deaf people. Many times when we go to the hospital, we don't get services because of communication challenges. The doctors don't know the signs. And sometimes we get given the wrong doses. For instance, if I point on the stomach, I can be given liver, maybe tablets for the same. And sometimes, so I want to ask, what can we do to make sure that the hospital maybe have interpreters or access people who can communicate in signs? Also, we also have a challenge. Most of the time, we stay on the lines. We don't know what is happening on the same. So if we can get preferences in that, we'll appreciate. Thank you.
Mheshimiwa, sijui kama ilikuwa ni maswali ama suggestion, but let me say this clearly. Vile tutadili na mambo ya people living with disabilities, we need to formulate policies. It's a policy issue, and I want to pick what they said as a suggestion, because I know even now we're struggling to account for PWDs because we don't know who they are, where they are. So we need to, even as a county, to register them so that we know where they are. What are the challenges? For example, the other day we're developing some our walkways, basic. And then we realized, you know what, there's an important partners or population that haven't been considered. People that are blind are unable to walk on our streets. It's at that point we said we need broadly to look at policy issues. And now that we have devolution, anchor them in our legislation, so that we have a law that clearly that stipulates how at every level, from schools, from early detection, from hospitals, from our roads, and generally everywhere. So let me say that I want to pick what you've said as a suggestion to already what the county is doing, and we will work closely with you in that will be positive to your demands, because obviously what you have said are suggestions that are positive contribution to us all. Sababu hujui mtu umezaliwa leo salama, hujui utazana ni kesho boss.
Lakini there's something you said that was very scary, that they can go to hospital and actually someone
interpreters I know we have, like for example in my office I have 2 interpreters, mimi kwangu, and because I've employed people living with this physically challenged in my office, so I know in my office there's 2 interpreters, and we will ensure that every facility, and that's why I'm saying it's a policy issue, Joe. It has to be anchored somewhere, in that they know if you go to a hospital, there's like you're having a clinical not have you. So we have picked it up. We'll find, I'm sure in Coast General they have interpreters. We're looking at the other cities. If there are no, we shall if there are no interpreters, we'll ensure that we do what? We keep some available for you, even if it have to be rotational basis in county. I mean, P&E is a critical conversation we are having as a county, but we shall see. What is necessary must be done.
Alright.
Na maswali bado yako mengi, tunapumzika kidogo, tutakaporejea kutakuwa na maswali mengi tu, moja kuhusiana na jinsi ambavyo watu wanalipia matibabu katika hospitali ya Coast General. Usiondoke.